In our video number 22, we will be discussing infrastructure. In our previous video, we learned the infrastructure consists of the economic infrastructure and the social infrastructure. Under the economic infrastructure, we have energy, and under the social infrastructure, we have health. Now, for this year, this energy has been deleted, so we are going to discuss only health. So let's discuss the health infrastructure. What is health? Health not only means the absence of disease, but the ability to realize one's potential. A holistic process that is related to overall growth and development of the nation. So that's the definition given for health. But who takes the responsibility? The government takes the responsibility. Why? To ensure the right to healthy living of all the people in the country. People's health can be assessed by taking into account certain indicators to health. So there are 3 indicators. The first is infant mortality and maternal mortality rates. That means the death of the child and the death of the mother. Then the second is life expectancy, how long the person is going to live, and the nutritional levels, how healthy the food intake is. Then the third indicator is incidence of communicable and non-communicable diseases. Communicable diseases, those diseases which spread through air, water, food, and non-communicable diseases which are personal diseases like the deficiency diseases. They are called as the non-communicable diseases. Now COVID-19 is a communicable disease because it spreads, right? So health infrastructure. What is infrastructure? Infrastructure, as we learned, is the support services. Infrastructure means the support services to healthcare over here. So what are the support services? Hospitals, doctors, nurses, paramedical professionals, beds, equipment, and well-developed pharma industry. Right? But why do we need this health infrastructure? We need this infrastructure to ensure a healthy manpower for production of goods and services. We need this health infrastructure to ensure accessibility to health services. Also to see that no individual should fail to secure medical care, whether it is curative or preventive, because of the inability to pay for it. Why should one suffer when he is not able to pay for it? And the government has taken up the responsibility to see that people live a healthy life. Now let's understand health infrastructure in India. The health infrastructure in India is divided into certain categories. The primary health, which is to identify, prevent, and control the diseases. Or let us say, control the prevailing health problems. Now it includes adequate water supply, food supply and nutrition, maternal and child health care, and essential drugs. Promotion of immunization against infectious diseases. Immunization is vaccination of those diseases which can be infected or which are communicable. Infectious diseases. Now in the rural areas, we find the ANMs. You must have heard about ANMs, who are auxiliary nursing midwives. They provide primary health care to people living in the rural areas. In the rural areas, the hospitals that are available are appointed with one single doctor, a nurse, and some limited medicines. The hospitals in the rural areas are called as primary health centers or PHCs, and community health centers or CHCs, and of course the sub-centers. When the health condition of a patient cannot be managed by the primary health centers, these people are referred to secondary health care, which include hospitals with better facilities, because primary health centers can only identify and control the prevailing health problems. Certain health issues cannot be treated in the primary health center, so they are referred to secondary health centers, which consists of better facilities like the X-rays, surgeries, or the ECGs and advanced medical tests, which generally are found in big towns and district headquarters. These not only function as primary health care providers but also provide better healthcare facilities. Now, the tertiary healthcare services include hospitals with advanced equipment which can handle emergency and complicated diseases and impart quality medical education and conduct research and also provide with specialized health care. Examples of these can be given as the AIIMS, All India Institute of Medical Sciences, New Delhi, the Postgraduate Institute in Chandigarh, the Jawaharlal Institute of Postgraduate Medical Education and Research, JIPMER, in Pondicherry, then National Institute of Mental Health and Neurosciences, Bangalore, then All India Institute of Hygiene and Public Health, Kolkata. So these are some of the examples of tertiary healthcare. Now let's look at the public health infrastructure in India. Since independence, efforts have been made to improve the status of health in the country. And India has improved its health infrastructure and made remarkable progress in improving the health status. So let's look at this. The government has the constitutional obligation to guide and regulate all health related issues such as medical education, adulteration of food, drugs and poisons, medical profession, vital statistics, mental deficiency, and lunacy. The central government evolves policies through Central Council of Health and Family Welfare. It collects information and renders financial and technical assistance through state governments, union territories, and other bodies for the implementation of the health programs in the country. Now, if you look at this public health infrastructure in India from 1951 to 2017, we find the hospitals, the government hospitals, have increased from 2,600 to almost 23,500. The beds have increased from 1,17,000 to over 7 lakhs. Then dispensaries have improved from 6,06,000 to 27,600. The primary health centers have increased from 725 to 25,600, and the sub-centers have shown an improvement from 84,000 to 1,56,000. The CHCs have improved from 761, of course, from 1981 to 5,624. So definitely we do see a lot of significant expansion in the physical provision of health services from 1951 to 2017. Coming to the private sector health infrastructure, the private health sector has been playing a very dominant role in delivering the services. Here, more than 70% of the hospitals in India are run by the private sector, and 2/5 of the beds available in the hospitals are in the private sector. Nearly 60% of the dispensaries are run by the private sector. Then this sector provides healthcare services to 80% outpatients and 46% inpatients. The private sector in India has grown independently without any major regulation. But some private practitioners are not even registered doctors, and these people are called as quacks. They are called as quacks. Finally, since the 1990s, owing to liberalization measures, the state of the art super specialty hospitals attract India's rich and medical tourists. Now, here it's very important that we understand what is medical tourism, right? Now, foreigners come to India for surgeries or liver transplants, dental, or even cosmetic care because of health services, which combine the latest medical technologies with qualified professionals. And they are cheaper for foreigners as compared to costs of similar healthcare services in their own countries. Now, if you look at the statistics in 2016, as many as 2 lakh foreigners visited India for medical treatment, and this figure is likely to increase by 15% each year. That is the assumption. And experts predict that by 2020, India could earn more than 500 billion rupees through such medical tourism. Health infrastructure can be upgraded to attract more foreigners to India.